So here we are on the porch of the Cathy Romano Health Center, and you might seem, there's Cathy Romano, and when I say Cathy Romano Health Center, that's actually what it's called. And there was a big plaque here, but Cathy, what's going on? It looks like the plaque is down. Why is that?
Well, it looks like we are going to get rid of this old building. It's served us well over the last 50 plus years, but it's time for a new health center. So we are in the midst of emptying everything out, and we'll be doing the takedown hopefully in the next couple of weeks.
All right, so let's see what's coming down. Maybe a little tour of. No, it's
The-
all bare bones in here right now. Is that correct?
Yeah. Yeah, so this was a place filled with lots of coziness and lots of great pictures and lots of health care went on here, both physical and emotional. And like I said, it served its time. It's an old building. This was here 50 years ago. This light's not working. There's an old hospital bed in here that's probably from the 40s or the 50s. That's going to go. So I've emptied everything out, and we're waiting for the permits to come through. We do have a fundraising drive for this building because it is going to be costly, but the new center will be fantastic. So the new health center, when we were designing it from the beginning, our thought process was that we wanted to make sure that the vision of the camp was in that new health center. So when I say that, we have a health center that is going to be green, very low carbon footprint. So the whole creation of it, that is the design. It will be a place where there won't be that off-gassing that often happens with a new building. The products that are being used are going to be natural products, and it will be a bright open space, lots of windows. It's going to have a better exam area. We don't really have an exam area in here, so where we can actually bring in a camper or a staff member and actually do a proper assessment. There's going to be more rooms. So if we have a number of children or staff who are unwell and need to be monitored, we will have 3 potential spots to put them in. We will have more bathrooms. Instead of just one toilet, we will have full bathrooms and accessible bathrooms, so that if we have kids or staff who have accessibility needs, that will be in place as well.
So, Cathy, I know when schools were closed around mid-March, the OCA, the Ontario Camps Association, and all camps started collaborating and discussing what a summer might look like this summer, which eventually did not happen, but we'll also be talking about next summer. I know you were part of a health task force, so maybe talk about that experience and this summer in the future.
So very quickly, the staff here at Camp Kawartha, and this is the senior staff, recognized that we needed to move very quickly to stay in touch with the science. The OCA has been an incredible resource helping us do that, but we met weekly via technology and ensured that we were all on the same page. Recognizing that we weren't able to open an overnight camp, that has not stopped movement forward. So we are discussing all of our strategies for next year, and that new health center will help within that strategy. And of course, we will be taking our guidance from the government and from our medical professionals.
From a personal side, Cathy, you've been here for a very long time now, so let's talk about what first brought you to Camp Kawartha.
So I came to Camp Kawartha because I have 4 children, and it was a bit costly to come to camp. So what I did the first year is I bartered my nursing services. I'm an RN, and I bartered my nursing services so that my children could come to camp. Over the course of that time, I ended up on the board of directors. I ended up as the chair of the board of directors, and have been involved with all aspects of the camp in regards to summer camp as well as outdoor ed. So I'm involved in all pieces of that camp. What keeps me here is the spirit of this place. There's something very special about Camp Kawartha that I can't put my finger on, but it is a place where it is welcoming. People here are good people who really want to make a difference in the world and make a difference in a child's life, and that has really kept me moving forward.
Great. What do parents need to know about children's safety and health while at Camp Kawartha, and what the nurses and the health center provides for their children?
So we are a partnership with the parents. We depend on the parents to offer or to give us the information about their children's healthcare needs, so that we have that information prior to their children arriving at camp. So that's where the partnership starts. We have open communication with parents, so we're assessing those health forms and ensuring that if there is a concern, that we are opening up that communication with parents so that they can share with us what their children need. And we are able to provide for their children here at camp a full-time registered staff. So there is a registered nurse or a registered practical nurse on site 24/7. Physician care is as needed. So some years we've had physicians who are able to come on site, or we take the children out to see a physician. Of course, we have our local hospital, which is a regional center, about 40 minutes away from the camp, so we have accessed that. All of our staff are first aid trained. Our tripping staff that take your campers out on trips, they are above and beyond first aid trained. So they have what's called a wilderness advanced first aid or a wilderness first responder. All of our staff are responsible for assisting with first aid, so they all have a little fanny pack that has first aid supplies. And so we empower these young people on how to provide first aid, of course with the knowledge and the support of the registered staff on site. We always look at risk. We ensure that our campers are taking risks, because that's how we grow as a human being. But we take risks in a way that we can maintain their safety, but at the same time allow them to reach a little beyond what they may be comfortable with. And like I said, that's really good for just normal human development.
Great.
The health center is a vital part of your camper's experience at Camp Kawartha. Whether it is for that first introductory visit with the nurse when your camper arrives on site, or managing the physical and psychosocial needs of our camp population, it is a busy hub and was in desperate need of an upgrade. The teardown has now happened, and we are now in the process of creating a health center that is environmentally friendly and will be able to meet the needs of our changing world. Any donation, no matter how small, will help us complete this project. For more information, visit our website.